Hi, Jonathan. My name's Paul Hendrix, and I'm a spokesperson for the Lung Cancer Foundation of America. I wanted to take the time to ask you some questions about the importance of screenings and your thoughts of how easy screenings are with the technology today.
Well, thank you, Paul. My name is Jonathan Villena-Vargas. I'm a thoracic surgeon at Weill Cornell Medicine, also a surgeon scientist. I think that, your first question is basically how important is screening, right? So screening is basically what's going to save the most lives compared to everything else. The reason that that's the case is that it catches the cancers very early, and that is the best chance for cure for most patients. So if you take every single patient, if you screen every single patient and caught all the cancers early, over 90% of the patients would be alive today. And that's why it's so important.
Really? Wow, that's impressive. Um, how would you say the technology has become more safe now compared to before?
It was always pretty safe. It's mostly imaging based. I think that the big distinction happened about 10 years ago. It used to be that you would just get an x-ray. Somebody that, your doctor would think, oh, my patient's got a cough, or maybe they smoked for a really long time. Let's just get an x-ray and make sure. It happened very rarely, and there was a big trial that showed, maybe x-rays are not good enough. So they started doing CAT scans on patients, and then they compared CAT scans versus x-rays and showed that the CAT scans is much better at picking up early stage disease, and the CAT scan is very safe. Sometimes people talk about radiation, but we actually use a low dose radiation scan. It's incredibly safe for the patient. It takes about 2 minutes to do, and it could potentially save a life.
Wow, that's incredible.